abnormalities that can mimic mitral stenosis are one that is on a congenital basis called the septate left atrium, and the other one is an acquired condition, a myxoma of the left atrium. This is the frontal view of the chest of an adolescent who had a septate left atrium. Note the prominent pulmonary artery segment, the enlarged hyla, the prominent vasculature, particularly in the upper zones. However, the patient did not have a large left atrium, and clinically did not have the murmur and echocardiographically evidence of mitral valvular disease. The lateral view of the chest showed evidence of an enlarged left atrium. Note the focal displacement of the esophagus and the increase in the surface contact of the heart with the sternum, suggesting right ventricular enlargement. Also, we note the vascular changes in the lung that are typically seen with blood flow redistribution in patients with mitral disease. However, the patient did not have mitral disease. This is the angiocardiogram of a patient with septate left atrium, called cor triatum. There are no 3 atria, there's only 2 atria, so cor triatum is a misnomer. And there is a septum that divides the left atrium into 2 compartments. One receives the pulmonary veins, as seen to your left, and the other compartment is the one that connects with the left ventricle and has the normal mitral valve. There is a septum, and depending on the size of the opening, more or less increase resistance to the flow of blood from the upper to the lower compartment will occur. Note that the left ventricle is normal, and note the normal mitral valve. The filling defect that crosses the left atrial chamber represent the septum of the left atrium. The treatment is very simple, is to open the heart and resect the septum.